In part one, we really dug into that Malaysian study on vitamin C and NAC for COPD.
Right, we saw that these antioxidants, particularly vitamin C, appeared to boost levels of glutathione, which is a major player in our body's natural defense system.
And I was especially struck by that potential link between oxidative stress and poor appetite, which can create a vicious cycle for individuals with COPD.
It's true, these interconnected factors, they can have a significant impact. But the more we understand those connections, the better we become at finding effective solutions.
So let's get back to the research. You mentioned earlier that NAC, the other antioxidant in the Malaysian study, also demonstrated some positive results. Can you elaborate on that?
Certainly. While vitamin C seemed to have a more pronounced impact on glutathione levels in this particular study, NAC showed some compelling effects on nutritional status, particularly when it came to body mass index and food intake. This is particularly relevant because maintaining a healthy weight and receiving adequate nutrition is absolutely crucial for those with COPD. It can influence their energy levels, their ability to fight off infections, and their overall quality of life.
It really drives home the point that even small improvements can have a ripple effect.
And what's particularly interesting is that the findings on NAC in this Malaysian study align with a growing body of research suggesting that NAC could be beneficial for COPD, specifically when it comes to reducing those flare-ups known as exacerbations.
Okay, let's talk about those exacerbations. Those sound pretty serious.
They can be quite debilitating. Exacerbations can trigger shortness of breath, coughing, wheezing, and chest tightness, all of which make breathing difficult and interfere with daily life. They can also increase the risk of complications and even lead to hospitalization.
So how does NAC potentially help in these situations?
Several studies have looked into the potential of NAC to lessen the frequency and severity of COPD exacerbations. Some of this research indicates that NAC might work by thinning the mucus in the airways, making it easier to cough up, and by reducing inflammation in the lungs.
So it's addressing both the symptom of mucus buildup and the underlying inflammation.
Precisely. And that dual action is a large part of why researchers are so intrigued by NAC's potential. It's important to note, however, that some of the research on NAC for COPD exacerbations has used higher doses than the 600 milligrams per day used in the Malaysian study.
Okay, before anyone listening decides to start taking large amounts of NAC, we need to clarify something. You mentioned that different doses of NAC have been studied. Is there a magic number when it comes to NAC and COPD?
Unfortunately, it's not that simple. Dosage can be quite complex. It often depends on various factors, including the severity of an individual's COPD, their overall health, other medications they might be taking, and their doctor's guidance.
So the takeaway here is clear. Talk to your doctor before starting any new supplements, especially if you have COPD or other health conditions.
I can't emphasize that enough. Your doctor is your partner in managing your health. They can help you weigh the potential benefits and risks, ensure the dosage is appropriate for you, and monitor you for any potential side effects.
Now, let's zoom out a bit. We've been focusing on NAC for COPD exacerbations, but are there any other potential uses for this antioxidant?
That's a great question. As it turns out, NAC is quite a versatile molecule. It has been studied for a wide array of other conditions, including acetaminophen overdose, contrast-induced nephropathy, which is a type of kidney damage, and even certain psychiatric disorders.
Wow, that's quite a range. It sounds like NAC has the potential to be a valuable tool in addressing various health concerns. What are some things people should be aware of in terms of potential side effects from taking NAC?
Well, while NAC is generally considered safe, especially at lower doses, some individuals may experience side effects. The most common ones include gastrointestinal issues like nausea, vomiting, or diarrhea. Some people may also experience headaches, drowsiness, or skin rashes. These are usually mild and temporary, but it's crucial to be aware of them.
Nothing too alarming, but certainly something to discuss with your healthcare provider.
Exactly.
Are there specific groups of people who should be particularly cautious?
Yes. For instance, individuals with a history of bleeding disorders or those taking blood thinners should talk to their doctor before taking NAC, as it might elevate the risk of bleeding.
That's really important information to have. Any other red flags?
People with asthma should also exercise caution, as NAC can, in some instances, trigger bronchospasms, those sudden constrictions of the airways that make breathing difficult.
So a conversation with your doctor is definitely in order before starting NAC if you have asthma.
Without a doubt, it's always best to err on the side of caution.
It seems like NAC is an intriguing area of research, and I'm excited to learn more about its potential applications.
Me too. There's so much more to uncover in the world of antioxidants and lung health. And in our next segment, we'll shift our focus to a different lung condition, idiopathic pulmonary fibrosis, and delve into NAC's potential role there.
Don't go anywhere, listeners. We'll be right back with part 3 of our exploration of antioxidants and lung health.